I think that going back and look at drugs already used successfully for other tumors and try to see if they can be used also for mesothelioma. Maybe not in the same, with the same protocol, with the same way that where they have been used, can be a good approach. And a good example of this approach is what we have done by using a drug which is well known to be a successful drug for some form of leukemia or gastrointestinal tumor, which is Gleevec. Gleevec is the brand name for imatinib mesylate, which is the chemical name of a specific inhibitor of one of those receptors I mentioned before. The name is it's quite weird, this PDGF receptor beta, but in spite of this name, I mean, the most important part is that this receptor is widely expressed, not in all forms of mesothelioma, but most mesothelioma. And this receptor is one of those molecules critical to induce chemoresistance. So we, as soon as we discover the importance of these receptors, we figure out if could be used a classical drug like Gleevec in mesothelioma with a different approach that the tumors where this drug was used before. So we did not aim to use this drug to block tumor growth because we knew that this wasn't working. But we thought that by inhibiting this receptor, we could get rid of chemoresistance. And this would allow a conventional chemotherapeutic drug to work better. So we started in this direction. We used the Gleevec, and we observed, of course, Gleevec was blocking all the targets we identified, and so we tried to test different chemotherapeutic drugs to see if it was possible to use a combination of this specific inhibitor with a general chemotherapeutic drugs. We see that after obvious experiments done in cell culture, we moved to an animal experimental model. And we use quite a peculiar model. We exploited the so-called genetic engineering. We modify human mesothelioma cells by introducing a foreign gene, a gene coming from a fish, which induce luminescence on these cells. So these cells basically were emitting light. And this allowed us to follow the growth and possibly the reduction of a tumor on live animals by imaging, as usually clinicians do with patients following by CT scan or other imaging techniques what's going on in the body. So we injected these human mesothelioma cells in mice. These are special mice called skid mice, and we observed, of course, the formation of the tumors by this imaging. And this was basically our model. And so we treat this animal where we induce the tumors with a combination of Gleevec with different chemotherapeutic drugs. And we came out with the successful combination of Gleevec and Gemcitabine. Gemcitabine is a very old, very known drug. And we knew that gemcitabine alone was not effective on our mice, and we knew also that was not effective on patients either. But as you may see, it's quite clear that the treatment of with the true drugs, gemcitabine and the Gleevec on the right column, reduce a lot the size of the tumors. We which we could measure with those imaging, and you see the graph on the left side, and also increase quite remarkably the survival of the mice. And also the pictures of the mice, I think, are quite convincing, because you can see that the right mouse is doing much better than the left one. Of course, the next logical step was to move from experimental animals to patients. And as I say, the network we established can be very useful sometimes. And this was one of those cases, because our results that we of course published in scientific journals, as we usually do, catch the interest of our clinicians, colleague. And so they started with a pilot study with the combination of Gleevec and Gemcitabine, which is the brand name of gemcitabine is Gemso. Let me explain what is a pilot study. A pilot study is something coming before the real clinical trial. It usually is done on a limited number of patients. We use 21 patients, which did not respond to conventional therapies that have to be done anyway as a first line. And so these patients were treated, and the results were very encouraging, because we got, for instance, 6 stable disease. Stable disease means that there is no progression of the cancer development, so the cancer stays there. And you may argue that it's not a big deal just to stop a cancer. You won't get rid of the cancer. But for mesothelioma, which is so aggressive, this is a very good result. We got also 1 complete response, which means complete disappearance of the cancer, 8 partial responses, which is an incomplete reduction of the tumor, and unfortunately also 6 progression disease, which means that the disease didn't stop, and unfortunately the cancer continued to grow. So you see, everything has to be seen on a statistical basis. And of course, there are some patients which are responding better, other patients which are not responding at all. And this is common in all clinical trials. But these results convince pharmaceutical companies to support phase 2 second-line clinical trial, which is ongoing and has been validated by National Cancer Institute. And so it looks like that the results which are coming in the next months, I guess, we are quite optimistic that at least this therapy can lead to a longer survival, which I repeat, for mesothelioma patients has to be considered a good result.